Over to you, Sachin. Thank you.
Great. Thank you very much. Let me share my screen and see if that is working or not. Uh, Great. Can you see my screen?
Yes, yes,
Yeah,
we can.
great. So, thank you very much, Joy, and really pleasure I could join this session. I would be presenting on behalf of Professor Wafai. He was supposed to take this session, but due to his unavailability, I am sort of leading this work. And I know that it has been really a long day, so I'll try and be quick with this one. This session is about understanding how to sort of give and receive feedback during the process of developing policy briefs, and also for any other scientific writing, including peer review journal articles, so that we can sort of elevate the quality and impact of the policy briefs, manuscripts, reports, or any other, scientific product that we will be coming up through this exciting work. So these are just the objectives for our session. We will, by the end of this session, we will sort of understand what is peer review's role in strengthening public health documents, including policy briefs, manuscripts, reports, or infographics, video graphics, video abstracts, or any other, output that we can think of. We'll also see that how to, sort of give and receive feedback in a structured way. And then we will sort of learn a few strategies to integrate peer feedback into the writing process, including the policy briefs that has been the objective of this sort of workshop. And all of these skills are critical for ensuring your work is sort of rigorous, actionable, and trustworthy. Um, so why peer review matters in public health writings? It is not just a gatekeeping process, but it is a cornerstone of, in sort of credibility in the science. For public health, where policies sort of affect millions and millions of people, rigorous review is important to prevent misinformation, disinformation, and build trust in the work that is presented through the write-up. So maybe we can think of a collective quality check that then ensures, that the research is translated into real-world impact. So from that perspective, the peer review really sort of adds on to the work. It provides the important credibility, integrity to the research, and it builds the trust between the readers and the team which has developed the research findings. This is just an overview of the review process. I have taken it from Kelly's work. This is for the review of a scientific manuscript, where generally most of you might be aware of this process, but we can go over very quickly about what happens when the manuscript is produced and submitted to a journal. So producing a manuscript is kind of a long process where you develop a research design, collect data, analyze your data, and then you write a manuscript. That manuscript then is submitted to a journal. Once the manuscript is submitted to a journal, it's at the editor's desk to make sort of, very quick review of what is being presented in the, in the journal, in the manuscript. And then at that stage, either the editor can decide whether to reject the manuscript without sort of, sending it for review, or if the editor thinks that the manuscript fits well with the journal's scope of work, or the the kind of articles that are being published in the journal, then it is sort of processed for the next editorial steps. Then as the next editorial step, the manuscript is sort of sent to multiple reviewers. Reviewers complete their reviews, and then there could be different sort of outputs of this process, where the reviewers might suggest revisions, the reviewers might suggest acceptance, and then reviewers might also suggest rejection of the manuscript. There could be mixed decisions, whereas some reviewers might say revisions are needed, whereas other reviewers might say rejected. At that stage, the editorial desk will take the decision in terms of what to do with the manuscript, and whether it should be rejected based on the collective sort of review, or it could be sent for the revision. When the revision decision is made, it is sent back to the authors. They are given specified time, and then they are asked to respond to the reviewer's comment and make revisions to the manuscript. Based on the revisions, then the manuscript could be sent again back to the reviewers to see if they are satisfied with the revisions that are made, or accept the manuscript for the publication. Or at times, for some journals, it is not sent back to the reviewers, and the editorial desk will take the decision of accepting of rejecting the manuscript, or requiring further revisions to the manuscript before it is accepted for publication. So that's the kind of journal, any journal sort of review process. In that sense, then it is really important for all of us to understand the sort of pillars of peer review process. These collective, sort of issues would help us to produce impactful and credible sort of, kind of outputs for our analysis. And these are four important sort of, issues where the review process can ensure that the research that we produced is of utmost quality. It is valid. It's also promoting knowledge, and it is impactful. The review process also helps with fostering collaboration and sharing of sort of views with the audience and the larger sort of fraternity in public health. And it also sort of helps in building and maintaining the public trust for the public health science. We can dive into each of them and see how important each of this pillar is. So the first important issue is that when producing your output, be it the brief, manuscript, or any other sort of, communication material that is produced out of the analysis, it is important to ensure that it is without any flaws. There are no mistakes in it, because flawed research can have multiple consequences, and that could be, sort of breaking the confidence with the audience about the research findings. It's also important that the material that is produced from the research is consistent, and it upholds the scientific standards, and in that sense, ensuring research quality and validity is really important. So this is an example of what would happen, if the quality standards are not mentioned and if there is maintained, and if the research is not sort of valid. This is a very famous study. Many of you might know about this study that Wakefield published a paper in 1998, and that was a paper on MMR vaccine. And it was reported that it could lead to autism. And although the paper was flawed, it was a case series studies of only 12 children. It was also found during the review process that some ethical violations were there in the paper. There was also an sort of declared conflict of interest, which was later uncovered during the review process. So when the paper was published neglecting some of these issues, there was backlash within the public health sort of fraternity, and a lot of people wrote to the journal regarding the study's quality and how the scientific compromisation has been done in publishing this research. And as a result, the co-authors partially retracted the publication in 2004. So it took almost 8 years actually to sort of, retract the paper. But by that time, there were definitely some consequences that were happening, and people were a little bit apprehensive about taking MMR vaccine because many people thought that it leads to autism. And once, this backlash happened, and after the partial sort of retraction, there were further more sort of, letters to the editor. This was published in Lancet, and, the journal re-reviewed the, publication. And by the time of 2010, the journal decided to retract the paper, the complete paper by that time. So when the journal sort of, have that investigation, they found that data was manipulated, and research was not done as per the standards. But as I said, during the period from 1998 2010, there were a lot of, this caused a sort of big damage, and people were hesitant to take this sort of, vaccine. And there was also sort of, setback to public health vaccines and prevention work in totality, because people sort of, didn't believe that this could happen in the sector. So in that sense, ensuring the quality and validity of the findings is really important. We can pause here. You might know some other studies in, of similar nature. If someone has something to share, maybe this is a good time where you can share the findings. I'm not sure, Joy, if we could have this interactive sort of mode, or shall I go ahead?
Yes, of course, we can have
Yeah,
any questions or
because I don't
contributions.
see anyone's face, but if someone has, similar
Oh,
sort of
you should be able to see us. What's happened to the camera? Please.
no, I don't. But anyway, I mean, if someone has similar example to share, if they have an experience to share where similar sort of retraction has happened, or there has been backlash on some of the findings, please feel free to share with others so that we can learn from it.
Nicola has a contribution.
Yeah, now I can see you all.
Hello, Sachin. A great
Hi.
lecture so far. I have actually one example because one of the topics that I, in my lab, evaluate with my professor is the creatine. So basically, the creatine is a supplement that is used by athletes. But many years ago, there was one problematic study that shown that creatine causes the kidney dysfunction. So basically, this study is very complex because there is a lot of different therapies but the authors made that creatine is the responsible of this one, and that was not the case. And after that, a lot of studies, a lot of money, a lot of energy was put it on to clear this misconception about it. But even today, people ask it, oh, is it good for my kidneys? And yes, if you don't know about creatine, creatine is actually very good for your kidneys, not bad. So nowadays, research as evaluating how creatine supplementation actually can improve our kidney problems. So this is very big problem in science. Not just with, even today we have problems with MMR vaccines. And even today, as I'm a father, and I still didn't give this vaccine to my child because I'm still skeptic, although I'm scientist. So it's very problematic because, you know, when I can be theoretical about it, but it's when your skin about it, then you think twice. So because of that, this is very important to say. And I think this is, I will have probably more questions about peer review and what do you think about it. But I think this is a very important thing because misconception and misinformation can make a lot of damage to science and trust in science that we lose today. So this is one example of creatine. So how he became the villain, but actually is very good guy.
Yeah, thank you very much for sharing that example. And this is really a good example. And, it is still prevalent in the sports and sort of performance psychology. And a lot of, athletes take creatine, to enhance their performance. And, before taking it, they will ask you whether creatine is safe or not, or, is will this affect my kidney? There are other, sort of also misconceptions about creatine, that, whether my hair loss will happen because of creatine and all that. And it is the most, sort of, tested and evaluated substance in the sports and performance psychology. And there is still this misconception about it. The another sort of, usually tested element is whey proteins. And a lot of athletes again take whey proteins. A lot of patients are given whey proteins when their protein intake is not sort of fulfilled, and there is still sort of misconceptions about proteins, whether this will affect my kidney or not. So there are, similar sort of, a lot of studies which have been criticized over years, and they have sort of contributed to the misconception and disinformation about the findings. And in that sense, it is the responsibility of the researchers to ensure that the results are of utmost quality and they are valid results before publishing them through any medium, be it just a scientific manuscript or any other medium, where there might not be peer review process, but there could be other review process that can be ensured to maintain the quality and validity of the results. For example, today, all through the day, you have been discussing about the policy briefs, and policy briefs might not, fit into the traditional sort of, peer review process, but then how we can ensure that the quality and validity of the results, it could be through various channels of peer review process, and it could be internal review, it could be sent to the, to the audience for which it matters. It could be also sent for an expert review to raise some of the questions about the quality, validity of the results that are presented in the policy brief. So the review process is really important to ensure that the results are valid. Great. I'm not sure. So then the other important, issue is about promoting knowledge translation and its impact. Peer review research is more likely to inform policies, programs in countries, in the regions, and they are really important, to sort of translate knowledge from one place to the other, and they also hold the impact of changing the sort of course of actions that are taken, based on the findings that are presented in these policy briefs or manuscripts. And one such example is, I mean, if we all can think of as HIV prevention studies in Africa, which sort of directly shaped a huge sort of funding effort, based on these prevention studies. PEPFAR funding was, an output of these prevention studies. So, there might be some other examples as well, where the promoting of knowledge translation and program and policy planning might happen, based on collective results of few studies. So, and in the recent times, I mean, all of us, we have seen this example where, during the COVID-19 sort of, outbreak, the initial results on the prevention strategies were published in multiple journals. And based on that, sort of, across the countries, a policy was adopted, and it included multiple measures, including, safe distancing, wearing a mask, or, washing your hands, not, handshaking, and, keeping distance from others. So that was a decision, which was kind of based on informing based on the knowledge that was produced instantly on the prevention of COVID-19. Maybe we can pause here again, and you might have some other, examples from your context. So if anyone is willing to share an example, that would be beneficial for all of us to develop collective understanding, please feel free to share it.
Anyone? The question is, can you think of a time when timely, credible research directly influenced public health policies or interventions? Again. Oh, you have no.
Okay. So me again. Hi, Sachin. So, basically, what first came in mind for me is one of the first actually randomized control trials ever, when they treated the scorbutt on the boats. So when the sailors was sailing 2-3 centuries ago, they have their scorbutt, that this is the disease when is like the lack of quality with your bones and everything. So basically they had when they included some citrus and the cabbage to the crew, they have less scorbutt than others. So basically when they do this kind of research, is not really research, they improve this very big problem for sailors in the middle century. So I think this is one of the examples that start the science at first place with randomized control trials. This is one of the first. And actually it was very implemented to all sailors in that time. So this is another example. COVID is the most recent one, and this is maybe the first one when we did it. So thank you.
Great. Thank you very much for sharing that example. Is there any other example from anyone?
Wakey. We're almost at the end of the session.
No problem. We can move forward. Yeah, so the other thing that happens, when you sort of share your research with others for reviewing, they just not provide the constructive feedback, but there is also an opportunity to learn from each other and to build a research community to, sort of expand your network. You can sort of, share your expertise with others and allow others as well to share their expertise with you. So this process sort of, helps in collaborating with others. The process also sort of, expands your network. This can happen, at multiple stages, if we can think of a process of reviewing a manuscript or sharing a manuscript for any review. It could happen, um at the manuscript submission stage, where you can submit a draft and that can be open to any improvement. Once you get the reviewers suggestions, there could be suggestions in terms of, could you please clarify the methodology? Could you please also include sort of recent studies from XYZ countries? So that allows you to look into the domain and maybe reach out to people for some suggestions. It can also sort of provide insight on reflecting and revising the material that you have produced. And once the publication is out, and it could be in any form, again, but that can spark further discussions. There could be, direct letters to the authors, letters to the editors based on the findings that are published. There could be presentations in conferences, and that can not just invite, sort of comments on the work or criticism on the work, but that can also help in creating avenues for further collaboration. People can come together and say that, oh, this has been an exciting sort of study or exciting research, and this might be applicable in our setting, and they might collaborate with each other to expand the work in different geographies. So peer review is not just a process where only criticism is done, but it can also open up windows for learning from each other, for improving work, and to sort of collaborate with each other. This process also, as this is the last pillar we have seen, this process also sort of helps in maintaining the trust in science. It sort of gives it the credibility and accountability because it has gone through the expert scrutiny. This process is sort of building of trust because it is transparent and it is open, and it kind of reinforces trust and confidence in the scientific findings and public health guidance. So we can maybe stop here, and this is a very small sort of case vignette. We can read this case vignette and come back to the questions and try and answer these questions in and sort of see what kind of safeguards are assured in the peer review process. So this is a very small case vignette based on a high profile study which claims that a new herbal supplement has been significant, that supplement reduces the risk of type 2 diabetes. And the paper, which is released on a popular preprint server, that has gained rapid media attention, and it is being widely shared on social media, and saying that so and so treatment is available now for type 2 disease. So community health workers as well, they have read this and they have started receiving questions from different patients, different groups of stakeholders, patients' bodies and their family caregivers, and some other healthcare providers about these findings. So we can sort of discuss it very briefly. So what do you think is the role peer review could have played in identifying the issues before this study has published? And then how can the community prevent any premature dissemination of unverified findings that can disturb the public trust? So these are two questions, but there could be other questions as well based on this case vignette. Any responses, any reflections on this case vignette? What is wrong here, and how we can sort of, prevent that sort of wrongdoing, to sort of maintain the trust in the review process. Any reflections?
Thank you. Thanks. Concerning this particular case, a preclinical test to reveal what the composition of the herbal supplement is will help. So we start with animal studies. Then after some time, we extend to clinical studies. That will now help to ascertain what is there before we go to the public with the information. And then there can be comparative tests on the efficacy of the herbal medicine and also of the medications. Then, of course, there are different causes of type 2 diabetes. So there can be a proper profiling of that particular community to know what the underlying causes of the problem is. So that will help, because now there'll be many scientists working on the drug at different levels. That will help with that. And how can we prevent premature dissemination of unverified findings that erode public trust? A major part would be, I think, funding helps. And then when we have a consortium of scientists working on the same problem, that will help, because they're working in a group, and then we can come up with specific response to the need of the community. Thank you.
Great. Thank you very much for sharing that reflection. It's, she mentioned about the various stages of producing knowledge in such kind of, sort of supplements. Are there any other issues with this, case vignette, or the way the findings are shared? Is there any issue with that, and what, could be done to prevent it? Do you see any issue here, for publication of such findings?
Yeah, hi Sachin, me
Yep.
third time. So yeah, I understand. This is why peer review is very important, because based on this, what I see, I could not tell what is the study type. It was randomized controlled trial. It was open label trial? Is it single blind, double blind, triple blind? Is it single center or multi-center study? Is there statistician in the study? Is there enough sample? What was the sample size? It was male, females, kids. Is what that these participants was healthy or not? What was their baseline glucose levels? Do they have any other therapies that they do besides this supplement? Also, what was is there a placebo group, or there was no placebo group? And if there are, what was the placebo? It was like inferior trial or superior trial? So there is a lot of questions about the methodology of this paper that actually can be done. And this is majorly done during the peer review process. And this is the very big responsibility of the reviewers to be very rigorous, especially in the method section and in the results section, because introduction and discussion are opinions, but method and results are actually what stands out of the paper. So I think these kind of things will help to not spread this preprint. But these days, when we publish paper, for example, I have some papers that are already in peer review process, but they ask me to have preprint while they're in peer review. You probably know that this is happening nowadays. But also, I don't know how can prevent others, for example, media, to not share that as spectacular news, because preprints put it in the headings that this is not peer review and that this information is not completely evaluated, etc. But I think that the journalist doesn't understand that. So this is your problem. So maybe we should restrict peer review, or somehow educate the media regarding the importance of the peer review to actually reduce all of the problems of this study, because to claim that some supplement is highly effective to reduce type 2 diabetes is very problematic. Maybe GLP-1 is one of the things that actually works these days, but for some herbal supplements, there is a lot of studies that actually show that they did not produce that. And the other things, if one study said this is excellent, but also we need confirmational studies. So somehow, I don't know how, we should address the media or the people that sharing information, the influencers. So probably some education regarding the scientific literature, because these kind of conclusions can be very harmful. So there is no clear solution to this problem.
Great, thank you very much. I think the preprint issue is definitely a big issue, and with now the way the social media is sort of blown out of proportion, different influencers reading different studies and organizing podcasts and sharing, these sort of findings in their podcasts, and the amount of followers that they have. Peer review is definitely a process which allows them to sort of put the research in the public domain without putting any sort of research which has not gone through the peer review process, would create a lot of issues in terms of sharing the findings, and there could be a lot of consequences based on that. And this example was basically related to that. Moving on, then this is just to sort of feedback is a process, and peer review is not just the one way of providing it. I mean, feedback isn't just one fits all kind of purpose. Informal input from communities to the very formal peer review process, it can serve multiple purposes while producing the output. But all the sort of feedback should ensure that the rigor is ensured. And there could be keys in rigorous, integrating both formal and informal sort of feedback. These are just, few examples of what kind of feedback can be provided. Informal feedback can be provided in, day-to-day sort of, verbal communication, or team groups meeting where people talk to each other and then they provide feedback based on their work. Formal feedback is more kind of structured. It's often in the written way, to peers or to even supervisors. The formative feedback is kind of a feedback which is provided at the learning stage and before the final evaluation or before the final product is kind of out. The summative feedback assesses the performance against the standards. And it also results in sort of grading or ranking of the product. The reader's perspective, or from the reader's perspective, feedback is basically centered around how readers would receive the output. Is there clarity? Is the evidence presented in such a language that common readers would understand? People who do not have any background in public health would understand it. Constructive feedback is more sort of balanced feedback. It gives, it is a balance. It has a balance between negative and positive, or strength and weaknesses of the output. Peer review, we talked about this process, and then the community feedback is often, during the research project, you can go back to the community members of your research, and before writing your findings, you can present those findings to them and ensure that the findings are representing them. So that's the kind of feedback or input from the community. In the interest of time, I guess we won't have sort of time to go back to go to all through these examples, but maybe we can sort of take a couple of examples and maybe try and develop our understanding of what kind of feedback is it. Maybe we can start with the first method. In the, sort of manuscripts, method section, you have mentioned modified Delphi technique. And the feedback, the reviewer has sent a feedback saying that it's not clear how your modification differs from the standard approach. Can you clarify this? Any sort of reflection? What kind of feedback is this?
Anyone? Peer reviewers in the room.
Maybe I can go to the previous slide and,
Monica has a contribution.
It's just an attempt. I'm not an expert peer reviewer, but I think it's to do with the way the methods have been written in more of a clarified way. So if you say modified and then there's a standard, then you would possibly define what the standard is and then further explain what this modification is, and maybe also give a justification as to why that particular methodology was chosen in that particular way or in that particular setting.
right. So it's more kind of a constructive feedback, the reviewer has provided. Maybe we can go to the the example where it says the reviewer has given feedback where it says replace social determinants of health with factors like housing and income that affect health. What kind of perspective or feedback is presented here? And I can go to the previous, slide just to make sense out of it. So this feedback is, do not use or replace the language, and instead of social determinants of health, you can use wording as factors like housing and income that affect health. Any thought on this?
Yes, Dagmar has a point.
Hi, Sachin.
Hi.
Perhaps formative guidance, because the reviewer is trying to tell the author the initial modifications that they would make, which will improve the article or the paper.
Right. It could be also considered as, along with what Dagmavit has mentioned, it could be also from the reader's perspective that readers might not understand, social determinants of health, and simplifying it for them, what these determinants could be might be also useful. These are some examples, you can go through later on when we share the, slides. In the interest of time, I would move, forward. So, how the, feedback or review should be given. These are some sort of principles of giving feedback. You need to have that openness, and the feedback should build sort of trust rather than disrespect between the reviewer and the reviewee. It should be very clear and specific. Using the SMART guidelines might be useful to provide the feedback. It should be also timely and actionable. It needs to have sort of both strengths and weaknesses, and it can balance that. It should use the empathetic language so that the receiver feels that this is kind of supportive feedback, and it also needs to be culturally sensitive and appropriate to the context and timing. So these are some examples, and if we can again pick up a couple of examples, and if you could think of, the alternative way to suggest what you would write as a feedback instead of the don'ts one. So what could be, the feedback? So for example, if we can take the first example, directly providing feedback, saying as, your conclusions are weak, um, how you might sort of, rephrase this feedback so that it is empathetic. It is sort of giving, the authors an opportunity to revise and also builds trust. What could be possible option, instead of directly saying that your conclusions are weak? Any reflections how you would rephrase this? Have you received any time, such kind of feedback from reviewers saying that the conclusion is very weak? And how did you feel and what you expected at that point of time?
So we can say your conclusion must be based on your findings, and they must be specific.
Right. So, rather than just saying that the conclusion is weak, the reviewer can also provide little bit guidance for the writers that why do they feel that the, conclusion is weak and how that can be strengthened, or how the conclusion can be strengthened so that the reviewer has a clear sort of, guidance in terms of what they are supposed to do. At times, we also see in the there is sort of, clash between the or conflict between what the reviewers are saying and what the authors are, suggesting. And, at times, reviewers could be very, blunt and say that, for example, the last example where they feel that high risk youth is a stigmatizing term, because if this is read, that then people will, start identifying a particular section of the adolescent community as risky youth. So if we want to sort of take in this comment from the reviewer, where the reviewer is saying that avoid the use of high risk youth, because that might stigmatize adolescents in the community. But the reviewer has not suggested an alternative term. How would you handle this kind of, review from the reviewers, and what would be your response in terms of, revising this term or providing an alternative or suggestions? How would you handle it?
Yes, Sachin, in my case, I think I would search for guidance, standard guidance on how to term, for example, what to call such youth. WHO, UNICEF usually has, those sites have such nomenclature, the standard that is non-stigmatizing, and perhaps guidance on what has been dropped and what has been adopted. So I would adapt that, and in my response to comments, I would actually provide the site, link to the site from which I got the new term, for example. Yeah.
Great, excellent. I think that is the way to handle then this sort of, comments. Moving forward, these are some sort of, feedback, three C's of, feedback framework for specifically for the policy briefs. One is about clarity, and the clarity is avoiding any jargon in your policy briefs, because they are not usually for the maybe scientific community, and it could be, for the larger audience. So making the policy brief very clear, understandable for all kinds of audience, and that's why clarity is really an important aspect of policy brief. The other important, area to consider is about credibility. Many times we see policy briefs where methods or data sources are not mentioned. If they are mentioned, they're very briefly mentioned, not providing, any valuable sort of insights. So it is important to, in order to develop the credibility to the policy briefs, it is important to provide detailed methods and data sources which are reliable and robust in the policy briefs. And then the other important aspect of any policy brief is call to action, that the policy briefs should have specific actions mentioned in it, and they need to be informed by the data or the findings that are presented in these policy briefs. So I have multiple examples, but I know we have limited time. So maybe we can go just through a one, example, and try and see what is, wrong in it, and how, the information that is provided in the policy brief could be improved. So this is just some excerpt from the policy brief, which was titled as Combating Anemia Among Adolescent Girls and School-Based Interventions. And it said that iron deficiency is a problem for girls aged 12 to 18 in Sub-Saharan Africa, and school meal programs could help. A study in Ghana showed positive results, and hence policymakers should invest in solutions. If we see the three C's around credibility, clarity, and call to action, what do you think? What is, sort of what are the critical issues here, and what is missing in terms of information, how we can build on the three C's for this excerpt? So that these findings could be robust, there could be trust, there could be very specific, call to action. What can be done, just to improve this sort of excerpt? So maybe I can just give some hints, or, ask very tailored probes. Instead of problem, what can be written, here? What would be useful for policymakers, programmers, or anyone who contributes to making policy, rather than just saying that iron deficiency is a big problem? What might be more informative?
Yeah, I think the problem doesn't bring out the magnitude. We don't know how big the problem is. So maybe we can use statistics to show how big the problem is, instead of just saying there's a problem.
Exactly. Uh, what other clarity issues do you think are there here? Because now there wasn't clarity about the problem, but are there any other clarity issues in this problem?
Yeah, so if you say policymakers should invest in solutions, what type of solutions should they invest in?
They've mentioned that school meal programs are the sort of an option, but do you think that it is very clear to make any decision regarding school meals, or is the information lacking for even school meal programs?
Okay, for me, I think if they say school meal programs, it should be specific on what meal do we want the girls to consume, because when you say meal program, they can bring cassava or sweet potatoes, and I don't think it's going to address the iron deficiency. So the specific meal that should be consumed by the adolescents in school should be as clear as possible. And also, they say that it's a problem in Sub-Saharan Africa. Then this study was done in Ghana. So I don't know if maybe another study can be done in other Sub-Saharan African countries so that we can get to put them together and do cumulative studies to say that the policymakers should invest in this, in the solution that is specific, which specific meal we are talking about, because we cannot only say the studies from the Gold Coast, then it has to be also implemented in the Pearl of Africa or something. Yeah.
Great. Yeah. You rightly mentioned that there is no specificity in the, in the programs, and one could think of whether what kind of school meal program is it, fortified school meals, or the, the school meal menu, is it daily? Is it like, snacks, or is it lunch? Is it targeted to, only girls or girls and boys? So that specificity of information is lacking. If we can think of, the call to action again, it says that school meal programs could be helpful, but then it does not really provide a specific sort of, call to action. And with whom, is it in partnership with some, big program like World Food Program, to scale up, some iron fortified meals. It does not talk about the cost of such program. So there is, a lot of, missingness in the information in the call to action. It also does not provide comparative cost assessment. If, iron deficiency is a problem, it does not provide comparison, say, for example, school meals or versus, say, iron supplementation, in terms of cost and effectiveness. And that might be really helpful for the policymakers to make an informed decision. So as we have seen, 3 C's, clarity, credibility, and then call to action, as much as specificity, robustness, and the informative data that is required, it's not there in this policy itself. There are some other examples. Again, in the lack of time, we might not be able to go through all of them. I think we are on time. But these are, some again questions to think of, and we can actually sort of expand this list of questions. But maybe we can pause here, and sort of think of couple of questions, where apart from these questions on the screen, you have received a feedback, and might not be we might not want to go into the technical feedback, but feedback that could be applicable, to all of us, and how or what kind of strategy has been useful to respond to that question. These are just some examples, but I would also like to hear from your side. Were there any questions that you have received, which sort of, kind of raised, questions about even the review process, and then you had to adapt a strategy for it? That can be useful for all of us. So if we can think of a couple of questions, so that all of us can learn from it, that would be really great.
Thanks a lot, Sachi, for walking us through this. It's been very informative. We appreciate sparing time. It's not easy waking up in the morning to catch up with us. We really appreciate that. Maybe it would be very useful to inform our PhD students how to avoid the predatory journals, because the consequences, and many people publish their work with them without knowing who they are. It's my humble request that you quickly walk them through that. Thank you.
Yeah, great. I think that's really an important, question. So, predatory journals are, those journals which may not have, a rigorous process, and they are looking for just publishing some money, based on, they might invite you to ask, they might invite you to publish in their journal. They might offer you some discount. These journals usually do not have specifics about the review process, submission process on their websites. So one really, important sort of aspect of any submission process is that thinking with your co-authors, what could be the best journal to submit the manuscript, and you invite from your co-authors regarding the submission for the article. This also helps, in trying to understand the scope of the article against the scope of the journal, whether, the article that you're submitting fits within the scope of the journal. It also sort of, help then check the websites of those suggested journals and see whether this article fits into it. Along with that, it also can help to really quickly look at the author's guidelines. A good journal should have an elaborate sort of author's guideline on its website, along with the information on who are, the board members of the editorial team, who are the editors, what is the process of the journal in reviewing and publishing the invited manuscript or, submitted manuscript. It will also give you an idea about what kind of articles are, published in that journal. And along with all of this, it will also have a clear guideline in terms of what are the fees and what is the licensing around that fees when you submit the article. So I think, the first step would be always to discuss the possible or potential journals that you want to target, and quickly checking through their websites to look at these different, sort of components of publishing process on their website, and to make sure that whether that journal is predatory or very well-reputed journal would be an important factor. So thank you very much for raising that question, Justine. Any other thoughts, any other comments from anyone, any experiences that you want to share?
Yes, I have a question. This is Rhoda Nekesa. To be honest, I've not had conflicting feedback from my reviewers for the past 2 papers that I have published. In fact, the one that I published recently, last month, I had a very good time from reviewer number 2, who gave me a lot of comments, but on each question, comment, he gave me how to address it, like how to, if it is more information I need to add, he or she gave me the articles I can get that extra information, or gave me other studies that have been done that address the same thing, so that I see through. If I agree with it, okay. If I don't agree with it, okay. So that was my best time of dealing with the manuscript in my life. Now, I have a question with how to balance jargon. From the previous question that you asked, like if you had said high-risk youth, but then a reviewer told you to use another term, can I use ChatGPT? Can I use AI to help me to get better words of how to do? Because I am sure I will get some words from AI that will help me to put there, then make the manuscript better. But some manuscript might not allow it, but I might get a solution there. How does a researcher go around using such tools that can be helpful, but then they are not allowed by the journal? Thank you.
Thank you very much. Thank you for your sharing your experience. And, it's really good to hear that you have a wonderful experience, of the reviewing process. And also thank you for that question. Now this question is really important, how to use the AI tools when, preparing your manuscripts. You particularly asked about the jargon, but I would say that it is not just limited to the jargon, but the sort of responsible use of AI in the manuscript preparation is really a big issue in scientific writing now. So in response to your question regarding can I look for the alternatives, on AI? My suggestion would be in sort of alignment with one of our fellow participants who offered a view on this earlier, that instead of using AI tools as the first resort to come up with alternative terms to any jargon, it might be always good to sort of visit the trustable and universally accepted resources within the public health sector. And these could be websites of some agencies, including World Health Organization, UNICEF, UNFPA, or any such organizations which have come up with the vocabulary which is widely accepted for such terms. And using that might offer a credible source for those terms. Many times journals or reviewers ask for citations, and to cite those resources is much easier. What happens with AI is that it includes some published, unpublished, credible, uncredible sources, and completely relying on those sources might not be useful strategy. So I would recommend to use credible sources as the strategy. But down the lines, AI is getting popular, and people are using it more often and often to produce their sort of research outputs using AI tools, and that has definitely raised a concern in the fraternity about how responsibly AI can be used in writing your manuscripts. Some journals now have started asking, when you submit your manuscript to these journals, they ask for a self-report where you have to state whether you have used AI tools to generate this manuscript, or used AI tools to edit some of the sections, especially languaging editing, or any other assistance while producing this the manuscript that you are submitting. So far, it is still the moral responsibility of the authors to sort of report such things. But down the line, I guess in coming years, it will be very critical now to to even for journals, to make sure that the articles that they have received go through a testing, of whether the articles are produced using any AI tools or not. There are different softwares that these journals use to identify how much text is taken, from various sources, and exactly these software show you, if the wordings are matching or not with those articles. And based on a certain percentages, these percentages differ from journal to journal. At the editorial stage, the journal decides, or the editor decides, whether to go ahead with the peer review of that article or to reject, the article. So in coming years, journals are also thinking about adding now, an item which would suggest whether, the article has been produced using any AI tools or not. But it's very important question for the fraternity now. Great. So we have reached towards almost the end of our session, and in terms of what are the key takeaways for this whole session. One is definitely peer review is really a powerful process which provides credibility to your research. It builds trust with your audience, and it multifolds the impact of your publication. So it should be seen as a positive process. When you are producing any research output, these 3 C's are important: that the messages are clear, they are credible, so they are informed by your methods and data, and the call to action is informed by your findings. And at the end, I would suggest that don't look at the feedback as a negative process. It's a dialogue to improve your research. At the end, with this quote, alone, our voices might tremble, but together they might develop transformative programs and policies. It's by very popular community health leader called Maria Gomez. I might end my session here. So thank you very much for having me and listening to me patiently. Thank you, everyone.
Thank you so much, Sachin. And that was really a powerful end of this session. The alone can work, but when our voices are together, then it's more powerful. And we've had so much. We've learned, at least from my end, I've learned a lot. I'm just wondering, in the next maybe 15 minutes, we can have feedback sessions. What went well, what could be done better, and what would be the next steps, especially for the policy briefs that we tried. So is anyone interested to progress with them? Just any feedback from the floor or questions?
Okay, Joy, I might leave now, but thank you very much for having me.
Thank you so much, Sachin.
Thank
We
you.
appreciate
Bye,
it.
everyone. Bye.
Bye-bye.